Welcome to Fresh Vitals. Spurious, Misbranded and Adulterated Medications Alert, August 2024. This important update on the latest alert from the Central Drugs Standard Control Organization, or CDSCO. Every month, the CDSCO releases reports highlighting medications that do not meet the required safety and quality standards. In today's video, we will discuss the alarming findings from the August 2024 report, which identified several spurious, misbranded, and adulterated drugs. These medications have failed crucial tests and pose serious health risks to patients. Before we dive into the specifics, let's quickly review what it means when a drug is classified as spurious, misbranded, or adulterated. Spurious drugs. These are fake or counterfeit drugs that are deliberately and fraudulently mislabeled with respect to their identity or source. Misbranded drugs. These are drugs that are falsely labeled or advertised, potentially misleading users about their content or safety. Adulterated drugs. These are drugs that contain inferior or unsafe ingredients, are improperly manufactured, or are contaminated. Let's now focus on the drugs highlighted in the August 2024 report. CDSCO identified a total of 48 batches of drugs that did not meet the required standards. These drugs failed tests for various parameters including identification, dissolution, and assay levels, which are critical for ensuring the safety and efficacy of medications. We begin with a well-known antibiotic combination, Amoxicillin and Potassium Clavulanate, marketed under the brand names Clavam 625 by Alkem and Mexclav 625 by Meg Lifesciences. Both batches failed tests for identification and assay of the key components amoxicillin trihydrate and potassium clavulanate. These drugs are essential in treating bacterial infections. The failure in identification means the drug may not contain the correct active ingredients, rendering it ineffective and potentially dangerous. Next on the list is calcium and vitamin D3 tablets, Shelcal 500, manufactured by Pure & Cure Healthcare. This batch failed the description, identification of vitamin D3, and dissolution tests. Vitamin D3 is crucial for calcium absorption and bone health, and any discrepancies in its content could lead to serious health issues, especially in those relying on this supplement for osteoporosis. A particularly concerning failure came from the metformin hydrochloride sustained-release tablets, Glycimet SR 500, produced by Scott Edel Pharmacia. This medication, used in diabetes management, failed dissolution tests. This means the drug might not release the correct amount of active ingredient, putting diabetic patients at risk of uncontrolled blood sugar levels. Rifaximin tablets, Rifmin 550, manufactured by Legend Healthcare, also failed dissolution and water content tests. Rifaximin is used to treat bacterial infections in the intestines, and such failures indicate the drug might not provide adequate relief. Even more troubling is the inclusion of paracetamol tablets, 500 milligrams, manufactured by Karnataka Antibiotics, a widely used pain and fever medication, which failed the description test. Additionally, pantoprazole gastro-resistant capsules, PAND, produced by Alkem failed tests for identification, dissolution, and assay, raising concerns for patients suffering from acid reflux. The report also flags formulations specifically made for children, including Montaire LC Kid, Montelukast sodium and levocetirizine hydrochloride dispersible tablets, manufactured by Pure & Cure Healthcare. This batch failed tests for uniformity of dispersion and assay, meaning the drug could be ineffective or harmful to children, who are among the most vulnerable patient groups. Some other notable failures include the ciprofloxacin tablets IP OSIF 500 by Ornate Labs, which failed dissolution and assay tests, and heparin sodium injection by Health Biotech Limited, which failed sterility, particulate matter, and bacterial endotoxin tests. These drugs are essential for infection control and blood thinning in critical care settings. The findings from this report highlight a critical issue in drug manufacturing and quality control. Spurious, misbranded, and adulterated drugs can have devastating effects on patient health, leading to ineffective treatment, drug resistance, or even fatal outcomes. If you are using any of these medications, consult your healthcare provider immediately. To ensure safety, always check the source and batch number of your medications. Purchase only from licensed pharmacies and avoid online purchases from unknown suppliers. Stay informed and protect your health. Thank you for watching, and please share this video to raise awareness. For more updates on medication safety, subscribe to our channel and hit the notification bell.